cooking?
It's my flat. What are you boiling up now?
Garlic. It's wonderful for the sinuses.
Oh, it reeks. Look at this place. It's like a squat.
Oh, I think it's very bohemian, actually.
Well, I want my living room back. You've got an hour to get washed and dressed.
Are you throwing me out?
I've had 2 weeks of coughing and snot. The kids are about ready to disown you.
Where are the children?
Take them to school, of course. The doctor will soon sort you out.
I'm quite capable of curing my own ailments.
Look, Mum. I've been patient. I've given you a place to stay when you got dumped by your latest squeeze. I've let you try all your homespun cures and mumbo-jumbo, but you promised me if you weren't better by this morning, you'd have the decency to give in and go and see a doctor. I'm worried about you. You've even had a couple of asthma attacks.
Oh, that was hay fever. I cured my asthma with yogic breathing.
You're not 21 anymore. You can't keep taking your health for granted. Put a bit of lippy on, you look like death warmed up.
Come on, you can do this. You can do this.
Papa. Thanks.
Hello.
Oh, hi. There you are. We're all waiting.
Oh, sorry, am I late?
No, come on through. Morning, everybody. I'm sure you'll join me in welcoming our latest addition to the team, Dr. Simon Bond.
Hey, I'm Jimmy Clay. Surprised you get your head through the door the way Heston's been singing your praises.
Though, truth be told, we tend to take what he says with a pinch of salt.
You can mock as much as you like, but this man's medical knowledge would shame any of us.
Really? I'm Karen, by the way.
Hi.
Well, if you've got any time wasters, send them to me. I'll sort them out. I'm Cherry.
Time wasters?
That's a bit unfair, actually. A majority of our patients have very serious concerns. Mind you, of course, there are a few eccentrics.
A few.
Yeah, that and the hypochondriacs. What?
Anyway, I'm sure that Heston will take very good care of you. OK, team? Time for the onslaught.
Julia,
Give me a minute.
I've got a bit of free time this afternoon. I thought I'd visit Ruth. What do you think?
Oh, yeah, that's a really good idea. Listen, give her a bit of a confidence boost before the assessment tomorrow, will you?
Bet you can't wait to get started.
Mother, I told you to get dressed. Your appointment's in 40 minutes.
Yes, but then I remembered my naturopathic physician told me licorice, wonderful for nasal congestion. So I thought if I chewed a few sticks.
And chew the furniture for all I care. Nothing is getting you out of this appointment. Now get dressed and get in the car. And wipe your mouth, you look ridiculous.
Hi, I've got an appointment with Dr. Carter. My name's Vincent Bukowski.
Bukowski. That's an interesting name. What's that? Is that Russian?
Polish. My grandfather was Polish.
Oh. Actually, you're early. 90 minutes early.
I knew I shouldn't have written the time down. I don't suppose there's any chance you could squeeze me in earlier?
I could try.
Brilliant.
Can't promise anything.
Thank you.
I promise you, Mr. Carver, hemorrhoids are nothing to be ashamed of. We've all had them, haven't we, Dr. Bond?
Yes.
See? Anything else you want to ask this chap before we send him on his way?
Well, just that eating a balanced diet with plenty of fibre is to be recommended, and come back if there's no improvement within 7 days.
Great. Good day, Mr. Cleaver.
Thanks, Doctor.
How was I?
Perfect. In fact, I'll keep Stumm for the next one, let you run the show.
You're not serious?
Of course. We'll keep the details from Julia for the time being. What she doesn't hear won't hurt her. Now, get yourself settled in, young man.
I believe I have an appointment. Don't ask me which doctor I'm seeing because it was made on my behalf, against my wishes.
Oh, don't be so dramatic. Can I have a name?
Pamela Blunt. And for the record, I'm here under duress.
Right. Are you a nervous patient?
No. I simply believe that the medical establishment is a bunch of charlatans who want to dose everyone up on drugs until they're like zombies. Huh? Humanity has been curing its own ills for thousands of years before someone in a white coat came along waving a stethoscope. I recently had great success with a golfing acquaintance curing her blisters by getting her to spray antiperspirant on her feet. I'm an expert with cold sores as well. You just let a little red wine congeal overnight and then you dab it on.
Blunt.
Yes? And you are?
Dr. Carter.
Am I supposed to be impressed?
Mother.
Well, lead on, Macduff.
And damn be him that first cries, hold enough.
You got your work cut out for you there.
Oh, tell me about it.
Mrs. Smiley?
I really should have called it something more appropriate, like Mrs. Grim Reaper. Do you mind if I move up one?
No, go ahead.
I'm afraid it appears we don't have your full medical record, Mrs. Blunt.
Well, that's probably because I've only set foot in a doctor's surgery about 3 times in my entire life. However, for your information, I am allergic to aspirin. I'm mildly asthmatic, a condition I've virtually cured myself of. I don't suffer fools gladly, and I still have my own teeth.
Right. And is there a specific reason why you've come to the surgery today?
Only that my daughter left me no choice. I don't believe in doctors, you see. Especially ones that look barely old enough to be out of short trousers. Do you really think that medical school has prepared you for the responsibility of other people's well-being?
Madam, all the physicians at this surgery are more than capable, whatever their age.
How long have you had that cough?
Well, actually, it's much better. I've been treating it with a combination of natural remedies. Honey, herbal teas, fruit, hot toddies.
All of which have never been proven to have any sustained or significant effect.
In your opinion?
Well, actually, it's the opinion of the entire medical community.
Yes? Well, when the medical community actually comes up with a cure for the common cold, do let me know.
How would you proceed?
He'd offer me antibiotics, of course. That's the medical profession's answer to everything.
Your instincts are fine.
Right. Has your cold triggered any asthma attacks?
A few.
Well, would you at least let me examine you while you're here?
He's only trying to help.
Oh, do we really need him here?
And you're renovating the whole place from scratch on your own?
Well, no, I've got some mates helping out, but I'm doing all the painting, all the plastering. Mind you, I've got more paint on me than I have on the walls.
It must be wonderful having all that space. My flat is like a bomb site.
Well, it's not exactly Buckingham Palace.
Thanks very much.
No, it needs everything doing to it. Pointing, plastering, damp proofing.
And it's just you that's going to be living there, is it?
Yeah. My decree absolute came through this morning, actually.
Really?
Yeah. I'm footloose and fancy free again.
Yes. You are wheezing a lot. Have you been using your inhaler?
4 or 5 times.
Right. Steroids? Okay. I'm going to prescribe you a short course of steroids.
Steroids are dangerous. They've been shown to increase the risk of osteoporosis, high blood pressure, and diabetes.
Mrs. Bunt, we wouldn't prescribe them if they were dangerous.
Well, I'm not taking them. I shall stick to my yoga breathing, thank you.
Oh, for goodness sake, take the medicine. You're obviously not well.
It's having to argue with a bully like you that's making me ill.
What? Oh, this is ridiculous. Have I bullied her? Well?
So why did you split up then?
The truth is, we wanted different things. I wanted kids, she wanted to concentrate on her career. By the time we realised, we'd already fallen out of love.
I'm sorry.
No, it's all right, it's in the past. It's the future that matters now.
I should never have let you talk me into this. In fact, I've a good mind to lodge a formal complaint. I have never been spoken to like that in my entire life. It's a disgrace.
Mum, wait, what happened? Mum!
How are you feeling about tomorrow?
Nervous. Feels like I'm sitting an exam.
Remember, this assessment is as much for you as it is for the mill. It's not designed to trip you up.
No, I know. It's just...
What?
I'm worried about what to wear. One of the things I've learned from my therapy is that I've tended to borrow from Michelle's identity by copying her dress sense. And now sometimes I find myself doing the same thing with Julia. It's not an intentional thing.
It's a subconscious thing. Well, maybe I can help with that. Perhaps you can use me as a sounding board. We could make a decision about what to wear together, if you'd like.
Take a seat, Mr. Bukowski.
Right.
How can I help?
Yeah, well,
Come in.
I'm sorry to interrupt. There's a walk-in patient. He's got something stuck in his throat. I think it might be a fishbone.
I'll see to it.
No, but Dr. Carter, but our patient. Perhaps you'd like to wait in reception.
I've already waiting an hour and a half. You are a doctor, aren't you?
Yes.
Right. Well, I've got this rash on my arms. Skin's a bit dry and itchy.
Perhaps you'd like to take a seat up here. I'm just going to check with my colleague.
What is it?
The nurse is with an emergency. She'll be with you shortly.
Are any other doctors available?
Jimmy's with a patient and Danny will be back in a minute. Why?
Well, I've got a patient with a skin complaint, and there are so many different types of lesions and infections. It could be anything. It could be eczema, contact dermatitis, necrotizing fasciitis.
Necrophiliac what?
Necrotizing fasciitis. It's a flesh-eating bacterial infection. Where's Heston?
He's with Jerry and the fishbone lab. Hello, Mill Health Centre.
Sorry to interrupt. Good grief.
What is it?
I need a second opinion.
You don't know, Dr. Bond, I'm busy. Will you hold still, Mr. Beasley?
With Dr. Carter!
Not now.
Oh, hi, you're Simon. I'm Daniel.
Hi, yes, sorry. Sorry.
Well, is it bad news?
Just a minute. Have you had any skin allergies or infections before?
No.
And when did you first notice the rash?
A week ago.
No. No. Nope.
Is it serious?
Yes, it could be. Definitely looks like eczema.
Eczema?
So, an emollient cream should clear up the redness.
You had me thinking it was gangrene or something.
Now, you may find that this is available over the counter, so it might be cheaper to buy it that way. And you'll need to apply it to the affected area 4 times a day. And come back and see me if there's been no improvement within a month.
Oh, you reckon, eh? Well, just a tip, mate. I think you need to work on your bedside manner.
That's it.
Well, couldn't bring everything with me when I moved in. So Michelle had one just like it.
And that's definitely not your colour. What were you thinking?
I was losing my mind.
Really? That's no excuse.
Right, better go and get a bin bag.
Actually, I have a better idea.
Where's the man that was here earlier?
Sorry?
The man with the damp. I was talking to him over there.
Oh, Mr. Bukowski, I think he just left.
I thought we came back because of me.
Yes, of course. I'd like to speak to somebody in authority, please. I have a bone to pick with whoever examined my mother.
Is it a Fishburne? Sorry, can I just take a name again?
That's one of them.
I had to spend the last half an hour persuading her to come back. You could at least have taken her condition seriously.
What? I did.
So why throw her out?
What? I'm sorry. I made a number of recommendations regarding your mother's cold.
The cold? That's all it is?
Yes.
But I was hoping it was going to be something far more serious than that.
You were actually hoping that your mother was seriously ill?
What? No. I didn't mean it like that. I know, couldn't you just tell her that it's worse than it really is? Then she'd be forced to take whatever medication you prescribed, and when her symptoms cleared up, she'd have to accept that drugs are really necessary.
You want me to forego the Hippocratic Oath so you can make a point to your mother?
No, you're right. We need to sit down and talk about this properly.
I think that would be a better idea.
I'll go and fetch her.
Right. What? No, I didn't mean with me.
You can do the honours.
You sure Julia won't mind?
Of course not. This is therapy. She'd be applauding. Go on.
I can't.
What's wrong?
I know it sounds stupid, but these clothes, they were very important to me.
You don't need them anymore, Ruth. You've moved on. And you've done that by being you, not pretending to be someone else.
It's all just a ruse to get me out of the flat.
How can you say that? Everything I've done today has been out of concern for you and your health. You see what I have to put up with? I've already got 2 children. The last thing I need is my mother turning into a stroppy teenager.
Is this really...
There would be no argument if you would just accept that I'm not going to pop pills to make you happy. I shall continue to treat my cold with ginger and licorice and pineapple and peppermint and oranges and blueberries just like my mother did.
Fine. You do what you want. I'm sorry for wasting your time.
How much of these things have you been eating?
Sorry?
The fruit, the ginger and licorice.
As much as she can. My sitting room looks like a greengrocer's. Why?
Nothing. It's
Are we
just...
staying or are we going?
Just a minute. What is it?
Well, it's just all those foods are high in salicylates. I suppose it's possible you could have developed an intolerance.
What? Sorry, what are salicylates exactly?
Well, they're found in aspirin and in certain types of food. There are high levels in all those foods you just mentioned. But you did mention you were allergic to aspirin.
Yes.
Well, it's the salicylic acid you're intolerant to. It's a natural derivative.
So she could have an intolerance. What effect would that have?
It could have provoked the asthma attacks.
Oh, nonsense. How can eating fruit make you ill?
No, it's not that. It's the combination of foods and the quantity.
What if she continues to eat them?
Well, if you have an intolerance and you ignore it, you can make yourself very ill. The asthma attacks would worsen. They could become severe.
You see? Now are you willing to listen? What would you recommend that she does?
Well, I prescribed a 5-day course of steroids to treat the asthma, but your mother refused them.
Mum, I'm not asking you to abandon everything you believe in. I just want you to get better. Will you please take the medicine? If it doesn't work, I swear I'll never bring the subject up again.
Oh, very well.
You mean it? You'll take them?
That's what I just said, isn't it?
How did you do that? I have spent years trying to persuade her.
Oh, I don't know, just use logic.
Oh, thank you so much. I'm very sorry.
Doing it again, aren't I?
Ruth. Just think about what best represents you. What would you feel most comfortable in? That's much better.
Oh, Simon, could I ask your opinion on something? I've got this rash. It's been itching like mad.
Probably just a bit of dry skin. Bit of Vaseline will probably do the trick.
Really? Oh, thank goodness. It's just when you said that bloke with the damp might have that flesh-eating...
What bloke with damp?
Mr. Bukowski.
Where exactly was this damp?
He mentioned a house he was renovating. Where are you going?
Oh, it's you.
Can I come in?
Well, this really isn't a good time. I'm expecting someone. What do you want?
I understand you've got a problem with mould.
Why, did you do a bit of damp proofing on the side?
It's possible there could be a link between the mould and your eczema.
Wait, you've already prescribed me something for that, and besides, as I said, I'm expecting someone.
Yes, but my diagnosis was flawed. If you already had mild eczema before moving here, the damp could have aggravated it. Did it get worse after you moved in?
Yes, all right, come on, come in. Right, well, it's in here. You know, there's really no need to go to all this trouble. I've got the damp-proof specialist coming in next week.
No, it's no trouble. One of my old university mates is an amateur mycologist. He collects mould.
Right.
And once you've had the damp proofers in, you shouldn't have any more problems. Can I see your rash again?
All right.
Yes, it does seem more inflamed. I think I'll prescribe a steroid cream to clear up the inflammation.
Look, I really need to get that. All right?
Yes, go ahead.
Hi.
Hi. You found the house okay?
Yeah, no problems.
Sorry, come in.
Oh, hello.
Oh yeah, this is Dr. Bond. He was just leaving.
Yes, we met earlier.
Alice and I met at the surgery.
Told Mum I'd try Bukowski in the book. Fortunately, there was only one.
Lucky for me.
Right, I should be going.
Yes, of course. Thank you. That guy gives me the creeps. Makes you feel like a lab rat.
Oh, I don't know. He's not that bad.
Are you not one of these women who, fancies doctors, are you?
No. Give me a man in a hard hat and overalls any day of the week.
All right. Well, I'll get changed then.
Finally! I was about to send out a search party.
I'm sorry. I had to speak to Mr. Bukowski. My diagnosis of his eczema was flawed.
Daniel said you almost mowed him down earlier.
Yes, I must apologise to him. My mind was on other things.
Yes, I gather we had a return visit from the indomitable Mrs. Blunt.
Yes, she wanted to make a complaint, but I think I talked her out of it.
All's well that ends well?
Actually, I'm not sure that it is.
What?
I do realise why you're being so nice to me, Heston. It's because you don't think I'm up to it. And you're right. I'm not the right man for the job. I'm sorry.
Poppycock, you're doing a splendid job. In fact, I was going to suggest that as of tomorrow you start taking your own surgeries. We'll keep the details from Julia for the time being. Now, lunch. I think fish is off the menu after the morning I've had.
Hi, it's me. No, I don't think I can do this.
Do you think my boobs are too big to you? Will you stop looking at my cleavage?
No.
What?
I mean...
How can you do this to me?
You know, I've always found doctors really attractive.
It's as if the equilibrium of the entire surgery rests in my hands.
Well, it's good to see you not being overly dramatic about it.
Great new drama isn't just for the evenings. A case of bullying gets way out of control in brand new Moving On, next on BBC1 Scotland. And as events at Westminster unfold, there's a BBC News special on BBC2 Scotland and the BBC News channel right now.